Okay, we're going to discuss Chapter 36, Chronic Illnesses, Disability, and End-of-Life Care in Pediatric Population. First, we're going to cover children with chronic or complex diseases. The scope of the problem is there are advances in medicine that often increase the viability of preterm infants, where in the past they may not have survived at certain gestational ages. Life-sustaining technologies such as mechanical vents and life-extending treatments for conditions that may have previously resulted in an early death have led to an exponential rise in the prevalence of children with complex and chronic diseases. Trends in care. Developmental focus is a current trend in care in which the developmental level of the child is focused on when planning care rather than their chronological age. This focus allows caregivers to focus on the child's strengths as opposed to weaknesses and promote adaptation and coping skills. Family-centered care is important because the child's family is a constant in their life. Parents become experts in the care of their child while attending to their health care needs. It's not uncommon for parents to become more comfortable with certain aspects of their child's care than nurses may be because it is something they do on a routine basis. It is very important that you form a trusting partnership with the family in a family-centered care. Family. Healthcare provider communication is another very important aspect in nursing. It's important that providers keep parents in the loop by being available, demonstrating competence, and engaging the child and parent in care and decision making. Doing so will enhance a trusting partnership and likely keep parents satisfied with their child's care. Establishing a therapeutic relationship is an important aspect of nursing care as research has shown that it predicts improved health outcomes. Remember that parents often provide a great deal of care for their child and they become the experts in their care. It is important that you recognize this as the nurse and include the parents in care planning for the child. The role of culture. Cultural factors may affect family needs and choices regarding the care of the child with specialized needs. Shared decision. Making between the child, family, and healthcare team results from honest communication and therapeutic relationship. Together, the parents and healthcare team can make decisions that are best for the child and family. Look at box 36-1 on page 1053 of your textbook. Normalization. This is a term used to describe the efforts the families make in order to ensure that the child has a normal life. For many children, this means going to school, participating in recreational activities, and etc. The child and family will often face many hurdles seeking normalization, and families may essentially revise their version of normal to adapt to the child's illness or disability. Nurses can help with normalization by assessing the child and family's everyday life, social support systems, and coping strategies, family cohesiveness, and family and community resources. The developmental level of the child should be considered when planning care for the child, especially when seeking normalization. So while we're talking about family consideration, effects on the child's chronic illness or disability on the parents and their responses to the child's illness or disability may be so intense that they directly affect the child as well as other family members that are coping. Mothers and fathers are often adjust and cope differently. Mothers may experience a peaks and valleys periodic crisis pattern, whereas fathers often experience a gradual, steady recovery pattern of coping. Mothers are often the primary caregivers, and fathers may struggle with their role as the protector being challenged. Single parent families represent a special concern as providing care for a child with specialized may be a great burden on the parent. Siblings of children with chronic illnesses or disabilities may have more issues than their peers. A number of research studies have shown that siblings are generally negatively affected by having a brother or sister with a chronic illness. Refer to box 36-2 on page 1054 and 36-3 on page 1055 and 36-4 on page 1056 of your textbook. Stressors within the family may be situational or developmental, and even minor stressors can challenge a family's ability to cope successfully. Coping mechanisms are behaviors aimed at the reduction of tension caused by a crisis. Several approach and avoidance behaviors are used in coping with chronic illness and are listed in the guidelines box on page 1057. Parental empowerment may be seen as a process of recognizing, promoting, and enhancing competence of the parent and may occur gradually as a strength and capabilities are focused on when providing complex care to their child. It is important for members of the healthcare team to recognize a number of feelings that parents may have, as well as different coping mechanisms that they may use. Learning to manage feelings of shock and denial, fear, guilt, anger, resentment, and anxiety promotes adaptive coping, and it's important that nurses help family members learn to manage their feelings. Families' reactions to chronic illnesses are manifested in the following stages: shock and denial, adjustment, reintegration, and acknowledgement. Okay, so for the child with a chronic disease, the child's reaction to chronic condition depends on his or her developmental level and their coping mechanisms, as well as others' reactions and the illness itself. It's really going to depend on family support. Look at Table 36-1 and Box 36-6. Nursing care of the family and child. Assessment of the family's adjustment to a child's chronic illness, disability, or death includes the availability of a support system, their perception of the event, their coping mechanisms, their stressors, and their response to the child. To help parents cope with their child's chronic and complex conditions, nurses must offer attentiveness, humanistic support, education regarding the child's illness, and suggestions for care, therapeutic communication, and refer them to available community resources, especially at the time of the diagnosis. Look at Table 36-2 on page 1062. There are also guideline boxes on page 1064, 1065, and 1067. I'm going to briefly discuss growth and development considerations. This is going to be a brief review. Remember, early childhood's basic trust, separation from parents, beginning independence. School age is industry and activity. Adolescence is developing independence and autonomy. Look at Table 36 on page 1060, 1061. As a nurse, it's your responsibility to assist the family to cultivate realistic goals and expectations for the child with chronic illnesses or disabilities. As we previously discussed, advances in medicine often lead to prolonged survival of the child, which leads to new decisions and new problems. Issues that the child and family will face as the child ages include independent living, marriage, employment, insurance coverage, and reproductive decisions. Now I want to jump to palliative care for the pediatric population. Palliative care is comfort and care that's given to a dying person. It focuses on the relief of symptoms, especially pain and dyspnea, and conditions such as loneliness that can cause distress and distract from the child's enjoyment of life. The focus is for the child and family to experience a comfortable, supported, and dignified end of life. The term palliative care is often misunderstood to mean little or no care. The goal of palliative care is to add life to the child's years, not years to the child's life. Palliative care includes decision making at the end of life, ethical considerations, what is good or moral, respect for the patient's right to self-determination and decision making, doing what is good, meeting needs, balancing benefits with risk and harm, to give pain medicine or not to give pain medicine. Think about that. Providing relief of pain and suffering, doing no harm, being honest, telling the child and family the truth, respecting privileged information, preserving rights, privacy, and dignity, keeping promises, and treating the child and family fairly. Treatment options for terminally ill children are hospital, home care, or hospice care. Hospice services are for children who are no longer benefit from curative care and treatment. Care is designed to provide sensitivity and support to the child in the final phase of life. Life is seen in terms of quality time rather than the length of time. The entire family unit is considered in hospice care so that all the needs of the child are met. So, care of the child and family. A child's anxiety about death often centers on symptoms rather than the act of dying itself. It's important for you to be honest and inform the child of what is about to be done and why. Encourage the child to express their feelings and to allow them to have as much control over what happens to them as possible. Listen to what they are saying to you, to their toys, and to other children. Much research has shown that terminally ill children are generally aware of their condition, even when parents advocate careful concealment. Failure to be honest with children leaves them to suffer alone, unable to express their fears and sadness or even the opportunity to say goodbye. The prospect of death is frightening to children. It is up to the parents and caregivers to help the child work through their feelings. Fears of the child. Fear of pain and suffering. Pain needs to be properly assessed and managed. Dying teenagers often fear symptoms of pain and suffering more than the actual death thought, so they need reassurance that their comfort needs will be met. Fear of being alone or dying alone. Parents are not being present at the time of the child's death. That is another fear. Reassure the child that they will not be left alone. Allow the child to verbalize concerns, thoughts, and feelings. Encourage the parents and family to take the time to listen to the child. Family roles and needs. The impending death of a child affects every member of the family. Guilt, anger, and sadness are just some of the emotions that family members are experiencing. Help family members see the role they can play in the care and comfort of the child. Parents need to encourage siblings to be open about their own grief as well. The family's religious associations can be a source of strength and support, as can caring neighbors and friends. Customs regarding death are usually unique to a given culture, and many cultures believe religion and faith are important aspects to the end of life care. Place of death. The place of the child's death may occur at home, in hospice care, or in a hospital. Special considerations. Special decisions in death and dying for a child may involve whether or not to keep the child in the hospital or utilize hospice care so the child may die at home. Visualization of the body, tissue donation, and autopsy, which may be required by law if it is an unexpected death. And then, of course, siblings' attendance at the child's funeral. Mitchell's Journey is a Facebook page or blog that the father of a child diagnosed with Duchenne started to chronicle his child's journey through his illness. I encourage you to visit it. It provides a great deal of perspective from a parent's point of view regarding a chronic and disabling illness, as well as death and dying. The messages the father relays are truly powerful. So if you want to, I'll actually provide the website under the resources link in this week's lesson. Grief and mourning. Bereavement or grief is a complex series of reactions that occur during and after the death of a loved one. Family members need to know that the grieving process is highly individualized and has no time frame during the first year. Many changes occur. Children may especially benefit from activities involving the memory of the child who has died. Anticipatory grief. If opportunity arises, as with an expected death, a child's preparation for death can be planned. During this time, the child and family experience anticipatory grief. However, in the case of a child, wishes, dreams, and desires can be planned and accomplished if they are known. The Make-A-Wish Foundation is a well-known organization that works with families in an effort to make the child's last wishes and dreams come true. With a sudden and unexpected death, parents and family members do not have that opportunity to make plans. so anticipatory grieving is rarely able to occur. Death is what occurs at the end of life. It is both normal and unique. As nurses, we are responsible for providing dignity, comfort, and support, as well as guidance and education to those in our care. Nurses must recognize that professional growth comes from our experiences, so with each new event, we learn more about ourselves. Take a look at the family centered care box and guidelines in the box on page 1080 of your textbook. Time is too slow for those who wait, too swift for those who fear, too long for those who grieve, too short for those who rejoice. But for those who love, time is eternity. By Henry Van Dyke. This concludes chapter 36 lesson.